Hello, everyone. My name is Dr. Margaret Bennewitz, and I am an assistant professor in chemical and biomedical engineering at West Virginia University. So it's really my pleasure to talk to you today about biomedical engineering, what it is, what has been my career path within the discipline, and then what I do on a daily basis. So let's get started. So what is biomedical engineering? So really, biomedical engineering is what we call multidisciplinary. It is a combination of a bunch of different fields from engineering, math, physics, biology, chemistry. So basically, biomedical engineers, they solve complex problems in healthcare with the ultimate goal of benefiting both patients as well as doctors. I'm just going to highlight 3 areas within biomedical engineering, but there are others. So these include biomaterials, biomechanics, and bioinstrumentation and medical imaging. My lab in particular, we focus on the first area, biomaterials, and the last one, which is imaging. But I'll give you guys just one brief slide on each so you can get a taste of what each area is. We're first going to start with biomaterials. It's pretty much as the name implies. It is materials that we're making to interact with the body. So I'll throw the first example of a contact lens. Everybody's familiar with contact lenses. Some of you even use contact lenses, but why is it so important to engineer these devices? Well, if you think about it, your eye is kind of, squishy. So you don't want something that's hard. You want a material that's going to be flexible, that's going to be able to, conform to your eye in the correct fashion. You want the material to be clear so you can see. You also don't want it to be, rough, because if it is, it could scratch your eye and cause damage. You also don't want that material to be a breeding ground for bacteria. So we want it to be antibacterial as well. So these are the kinds of things you think about when you're designing materials that have to interact with the body. So other examples, I'll just briefly highlight the one on the upper right here. These are what we call stents. So basically when people get atherosclerosis, which is basically narrowing of the arteries, we can then implant a stent, and that can open up to expand back that artery so you can get better blood flow. Now, also, you'll see here, drugs. So drugs are important with biomaterials aspects because we need to design these biomaterials so we can control when and where the drug is going to be released. Another problem that may occur, especially in older people, is their heart valves may start to malfunction. So you might need another heart valve, which could include a metallic one that's not pictured here, or a biological type of heart valve that you can see here. I think this one is from a pig. Now, another option that you can have is if you end up having problems with your joints, you can get an artificial joint. So in this case, this is an artificial hip joint. So we see our ball part here, and we see the shaft going down, and then we also have kind of the socket part or the cup part. And this is basically important because they usually make them of different materials, so that when you have your cup part, which I think is usually made of polymer, and then you have the ball part, which sometimes can be made of metal, so that these two can interact without having too much rubbing and debris going on. Another area that's really important is biomechanics. So really biomechanics is the study of human movement. So really what one of the professors in our department, Dr. Jessica Allen, does is she is all into the biomechanics. So her lab is set up so she can have patients wear athletic gear, then she can put little reflective sensors on different joints within their body, and there's cameras put up all around the room. And the idea is when people are moving, they can actually track with the reflectors the angles of these joints. They can also have force plates to study the forces or the loads that are impacted on these joints. So you can actually study how normal people are moving, but you can also study how diseased populations move. So even people that are older, so you can actually study why are elderly people more at risk for falling, or why do stroke patients have problems with moving around? How is that impacted compared to a normal person, and so forth. We can also even look at stuff for making safer cars. So we can put sensors on crash dummies and find what are the forces put on the joints in when the car has an impact, so we can make safer cars. Another thing that I thought was super cool that I ended up seeing when I was a poster judge at one of our undergraduate conferences was that they were studying movement of people while they were running. So why is that important? Because shoes can impact the different forces that you end up impacting as that person is moving. So we can use this either to get the best selection of shoe for that person, or maybe try to even design better shoes. And the last area is biomedical imaging and instrumentation. So as you'll see here, if a person, they lose a limb, we want to give them back their independence. So we can go and we can try to make new artificial limbs with, robotics and sensors. So why is this, so interesting and fascinating that this claw thing, the hand, it can hold this egg without breaking the egg? Well, if you think about it, you have, a mechanical arm, right? You can teach it to grab things, but the key is how hard is it grabbing things? So we have to incorporate other things into the hand, such as pressure sensors, because you don't want this hand. I mean, one thing is an egg, but if you want to use a hand to shake somebody else's hand, the artificial one, right? You don't want that artificial hand not realizing how much it's squeezing the other person, so it hurts them. So that's why these kind of finesse things to basically improve the equipment is very important. And this is what biomedical engineers can do. So there are different ways to interface this type of arm with a person's kind of brain waves and everything. So they can do it. One way is to implant sensors within the brain itself to be able to communicate with the device. I think some of them you can even do by a cap, as you can see here, but I think in this way, this person was not controlling an arm. This type of setup also is similar when you're trying to monitor brain function. So one of the examples is an EEG, which is basically studying the electrical activity within the brain, and they can use this type of thing to figure out where if a person has epilepsy and they have seizures, they can determine where that abnormal brain activity is coming from. Now, other examples on the bottom in these first two panels here are just for normal imaging. You're all familiar with ultrasound. That's where you have the little cold gel that kind of squeeze on you, and they have a little transducer, and that probe is basically placed where the gel is, and it pushes out sound waves, and we can image how that tissue looks like without having to cut into the person. So this is commonly used in obstetrics, basically for when a woman is pregnant. They can look at the baby, they can look at how well that baby is growing over time, and they can even look for abnormalities, so they can determine if certain interventions need to be done. They can even look at the sex of the baby as well. Now, other types of imaging you can see here, they're very similar. A lot of these look the same for MRI, which basically uses strong magnets and radio waves, the 3D X-ray imaging, which is called computed tomography or CT, and then also the positron emission tomography or PET imaging, which is nuclear medicine. It's all the same, where you basically have the patient that's on the bed and they are advanced into the tube. And then all of these techniques, they use different kinds of radiation or energies, but they all get three-dimensional images of the patient's body without having to do anything else. Now, the last one is just an example of a glucose sensor that you can use that to kind of make the sensor more efficient in its operations. Now, what got me interested in biomedical engineering? So I knew that I really liked math and science growing up. I kind of figured I'd probably be an engineer because my dad was an engineer. It might just be in my blood, I don't know, but I didn't know what specific type of engineering that I wanted to go into. I actually thought potentially I might be a civil engineer because I thought it would be cool to build bridges or build the next really awesome roller coaster, because my brother and I, when we were growing up, we actually had this computer program that we could design roller coasters and test drive them. So I just found that really, really fun. So we actually were, in freshman year, we were introduced to the different facets of engineering. And it kind of piqued my interest when they presented about biomedical, but it really wasn't until I did a research paper with my friend on a device called the cooling cap. So with this device, it's really amazing. You actually have a small percentage of babies when they're born, they're actually physically blue. And that occurs because you don't have enough blood flow, you don't have enough oxygen going to the baby's brain and their body. So what can you do? To fix this problem, you can actually put the cooling cap device over the baby's head. There's also other versions where you can put this through the whole body. And the idea is that you're just circulating really cold water through this cap. And the idea is that you can actually decrease that baby's temperature within, their head to induce a state of hypothermia. So why is that important? So this is the process, how it works. But before I go any further, the actual disease is kind of a mouthful: hypoxic ischemic encephalopathy, or HIE. You can look it up if you're interested to know more about it. But what the cooling cap is doing is it's cooling the infant's temperature down to 33.5 degrees Celsius. The normal body temperature is 37. So this is kind of significant. We are decreasing the temperature quite a lot. And they prolong this lower temperature for about 72 hours. So it is multiple days. Now, why are we doing this? The decreased temperature is basically just going to slow down the whole body's processes. So it's not going to use as much energy. And through this, we can actually help the baby's tissues to recover. And we can basically make it so that you're not going to get as much brain damage, and the baby can survive and be better after this type of intervention. One last thing that I wanted to mention here, as far as why I'm interested in biomedical engineering, basically a movie came out around the same time as I was doing this paper. It's called Something the Lord Made. I thought it was a very, very inspirational movie. It was also about blue babies, but they were blue for a different reason. So they're actually blue because they have what we call a congenital heart defect. So they're basically born with problems within their heart itself. So what these two men did in the movie is they ended up coming up with a new surgical procedure to be able to fix these defects in the heart. And it really got me interested in the medical field in general. So if you guys have some time and interest, I would definitely suggest you check it out. So what does my career path look like? So really, as you know, I started at the University of Pittsburgh. I got my bachelor's degree in bioengineering. And one thing that I do want to plug is if you're at all interested in research or going on to graduate school or doing research in industry or in government, definitely try to see if you can snag yourself a research opportunity as an undergraduate. Really, the earlier that you start, the better, because you can tell if you like, research or not. So I did some undergraduate research. I was working with cystic fibrosis, which is basically where you end up getting kind of like pockets of mucus within your lungs. So it makes it harder for the cilia that line your airways to beat. So things kind of get trapped in there. It's not as easy for you to fight off infections. So cystic fibrosis patients also can get bacterial infections quite easily. So I was using different imaging techniques. I was using 3D X-ray imaging to see the mucus plugs and where they were, but I was also using functional imaging where patients would end up breathing in these radioactive aerosols, and I could see how fast they were clearing these aerosols from their lungs, and that's what you see here is the radioactive picture. And if you watch that as a movie over time, you'll be able to see it clearing. So I was really trying to combine and correlate anatomy with function so that we could end up using these imaging techniques to design new drugs for cystic fibrosis patients. Then I moved on and I got my master's degree and doctoral degree in biomedical engineering at Yale University. I still stayed in imaging, but I went into a different organ and I went into studying brain cancer. So really I was trying to develop new imaging techniques to be able to better detect glioblastoma multiforme, which is an invasive, really very aggressive type of brain cancer where the life expectancy is very poor. Now, I also want to stress that in your life, definitely make sure you maintain hobbies. Do things that you think are very, very fun. So as a graduate student, I not only did dancing, I also participated in this group. It plays an instrument called the carillon, and you can see that pictured here. It's basically kind of like a piano in that you have these batons that are wooden and you kind of bring them down, you kind of play them, flick them with your wrist. So the notes are very similar to a piano, but instead of playing piano keys, you are playing bells in bell towers. And this was Harkness towers you see here. You also play with your feet because the lower 2 1/3 octaves are repeated on kind of the pedal type areas. But I was able to tour throughout Europe and the United States with this group, so it was very, very amazing. Even now, I still enjoy dancing and singing, and my newest thing is that I just started diamond painting. So I would suggest always trying to challenge yourself to do new fun things, just so you can keep life kind of fun and light as you go through and progress. Now, I also did 2 postdocs. I did a postdoc at the Massachusetts Institute of Technology, but it was a very, very cool type of program where it was a collaboration between Madrid and Spain. So I got to live in Spain for a few months. It was an amazing experience. The idea here is they picked me and 9 other people from around the world, and we had to come up with what we call clinically relevant unmet needs in healthcare. So what are these unsolved problems that need to be solved? And we want to be able to use imaging solutions to solve these kinds of problems. So what we got to do is we got to talk with clinicians and researchers and our families and friends and come up with projects that we wanted to work on. The one that I ended up working on, or one of them, was trying to use optical imaging as an early detection method for ovarian cancer. And another project that I worked on was trying to use ultrasound imaging to diagnose bacterial meningitis. Now, the last cool thing that I did in this postdoc is that I got to spend some time kind of being a doctor, just observing in the operating room. So that's why you see me in scrubs here. So I had the phenomenal opportunity in Madrid to be able to observe cataract surgery, a spinal surgery, and even an open heart surgery. I got to see them crack open the chest, go in with these metallic expanders, pull open the chest. Then they had to stop the heart. They had to, have the whole heart function with a machine they call the heart-lung machine. So basically that machine will oxygenate your blood, and it will basically bypass the heart and keep everything pumping into the rest of the body so they can stop the heart and perform their procedures. And I got to be able to see them remove an old heart valve and suture in a new heart valve. It was just a very, very amazing experience. It got me even more interested in the medical field. The only unfortunate thing that happened is my aunt ended up passing away from pancreatic cancer. So it made me kind of reevaluate my life and really, what did I want to do? What was most important? So really what was, driving me is that, career had always been the most important up to that point, but family, I reflected, that's really important too. And at the time I was doing a long distance relationship. So I decided to go back to the Pittsburgh area where my husband was at the time. So I was able to return back to Pitt, where I did another postdoc in the Vascular Medicine Institute. And here I developed an imaging technique where we could image the lung, and we could look at different blood cells as they're moving through blood vessels within lungs. And the idea was so that we could look into mechanisms of how different cells within the bloodstream kind of clump together, just like if you imagine a clump of hair clogging a drain, right, or a pipe. That's how in sickle cell disease, you end up having different cells within the blood. They can clump together and kind of block the flow of blood. And if you can imagine, that'd be very, very painful, and you can have organ damage beyond that point because you no longer have blood flowing to that area. So then after the postdoc at Pitt, then I ended up coming to West Virginia University, where I am right now currently. So that brings us to the last question: what does my day-to-day job look like? The cool thing about academia is it is extremely flexible. It's not really a 9-to-5 job per se, and it's different every day. So what do I focus on? I focus on 3 different areas. I focus on research, teaching, and service, and I'll just go through each of those right now. So as far as the research goes, within my lab, I already told you we focus on imaging. I'm just going to focus just 2 projects to just highlight them. The one that you see at the top, what we're trying to do is come up with a new contrast agent for the early detection of breast cancer. So really we're using magnetic resonance imaging, which is using strong magnets and radio waves to be able to try to get a better, clearer picture of the cancer when it's in the breast tissue itself. Now, the normal agents that they use is called gadolinium chelates. They basically inject that agent into the veins that will travel around the body, and then that will go out into the tissue where you have the tumor to be able to specifically highlight that tumor. The main problem with the gadolinium, though, is that it always gives you a signal no matter where it is. So it makes it harder to find where that tumor is. So we wanted to come up with another agent that could be pH sensitive. So basically our agent, the idea is that it's off, or it's not giving any signal when we inject it into the veins. And then when it gets into the tumor, we can direct that agent to be able to be specifically taken up by breast cancer cells. As you can see here, our agent will get shuttled into these little low pH sacs inside the cell we call endosomes and lysosomes. Our agent kind of breaks apart, gives us these manganese-free ions, and that's able to give us a bright signal on our MRI. Now, the other half of my lab is using the lung imaging technique that I developed in my postdoc for sickle cell disease, but we are now using this to determine how does breast cancer spread from the breast tissue to lungs. So what we have is we have a mouse here. It is anesthetized, so it is asleep, and we mechanically ventilate that mouse, so the machine is breathing for that mouse. We can inject different dyes into a catheter that we have through the artery. We can inject intravascular fluorochromes to light up blood vessels. We can inject fluorescent antibodies to light up certain cells within the blood vessels. And then we can end up doing our imaging. So really, how do we immobilize the lung? We kind of have to go through and we have to cut away the tissue. So we have a hole within the rib cage. We come in with our micro machine device that has a little cover slip on it. We put that over the hole. We add a little bit of suction pressure and it sucks a little piece of that lung to the cover slip. And then we can image what's going on inside the blood vessels of the lungs in real time within these mice. So I'm just going to show you a little movie. My video might end up skipping just a little bit. What you'll see here, 4 different colors. What we've done in green is we've injected basically green, glowing green breast tumor cells. We've injected them into the breast tissue of the mice. They will travel on their own to the lungs. So this is actually a metastatic lesion that has gone to the lungs. You see the tumor cells in green. Our immune cells, which we call neutrophils, they are in blue, kind of surrounding this green mass. The neutrophils themselves are kind of spitting out little DNA fibers. We call them neutrophil extracellular traps. If you think of a fisherman's net, it's kind of exactly the same thing, just made of DNA. So that DNA fiber is shown in red here, and then the kind of pinkish magenta type color, that is showing you the blood flow and the blood vessels themselves. So really we're trying to study and use this imaging technique, how are tumor cells kind of recruiting normal blood cells and bringing them to the dark side to help them spread to different organs within the body. So another thing that we do, one thing to note is actually as the professor, so I don't do quite as much research now in the lab. I've actually teach my students how to do the experiments, and I observe them and mentor them and help them troubleshoot these kinds of experiments. So one part of it is actually doing the research. The other part is disseminating the research. So how do we get our research out there? We can go to conferences, which we do several times a year. We go to local conferences, also national and international conferences. This is an example of when Celia, one of my graduate students, and we were going to the American Institute of Chemical Engineers, or AICHE, to present our work. So this is cool because you get to end up having either an oral presentation where you're doing what I'm doing now, kind of presenting with slides, or you can have what they call a poster, which you have, a piece of paper that you have, typed up all of your findings. And the poster is kind of a little bit more personal and a little bit laid back. So this is one of my undergraduates who has since graduated. Her name is Jasmine. She did work with me as an undergraduate and is now currently in medical school. So another thing that you can do besides conferences, but they're also really good for networking type of opportunities as well. So basically talking with other researchers and industry vendors and people from other schools, things like that. Making connections very, very important. So another thing that we do is work on publishing our papers in different kinds of journals. So one kind of paper you can do is what they call a methods paper. So you can teach people how to do something that you know how to do. So in our case, we wanted to teach people how to make our metal oxide nanoparticles, which are basically our contrast agents that we're using to detect breast cancer with MRI. So this is Celia. This was obviously done during the COVID times. It was actually really, really fun because we got to go into the lab. We both got interviewed, and Celia ended up performing the procedures that Jove ended up filming for us. And Jove, the journal was called Journal of Visualized Experiments, or Jove. Then also you can do regular papers that are either a review of the literature or actually describing your experiments. We've published other things in PLOS One and breast cancer research as well. So the other facet of my job is the teaching. So I teach classes at both the undergraduate as well as graduate levels. For the undergraduate, I teach biomedical imaging as well as biomaterials. For the graduate level, I teach principles and applications of biomedical engineering. That's kind of like a jack of all trades, where it's a good overview of biomedical engineering in general. I really like it because we have a lot of discussions in that class, and we also help students to be able to learn how to write grants. And basically what grants are is they are documents that you write to try to get your research funded. Now, these pictures that you're seeing here are all from when I was teaching during the pandemic at home. So all of these are from my imaging course. Here you'll see in the top right, this is showing you total internal reflection, where I have a laser, a piece of plastic. If you have this laser angled greater than what they call the critical angle, the laser kind of bounces back and forth within this plastic rod, and it does not enter into the air. So it's a very effective demonstration of the technique of the total internal reflection that I'm trying to teach in class. It's also practically very important for microscope applications because they do use this technique to visualize the footprint of cells. They can look at adhesion molecules and other things. And then it's also very important in communication because it's a very, very efficient propagation of light. Now, this is what I'm showing you here. I was using a skeleton stencil as well as UV light and light sensitive paper to teach students X-ray contrast. This kind of thing was for ultrasound, because they have a type of ultrasound called Doppler ultrasound. So I was showing kids how the Doppler effect works. This was just funny because I think people just think I look funny. So it's one of their favorite demonstrations where I literally have a tone generator, something that makes a really annoying high-pitched sound. I have it on a rope and I kind of lasso it around like a cowboy. So that shows people how the sound changes as it's moving towards you and as it moves away. So basically, as it moves towards, it's more high-pitched. As it moves away, it's more low-pitched, even though the tone that's coming out of the generator is the same the whole time. And one of these last examples is when I was using a slinky to show people how the sound waves propagate in ultrasound. Now, the last part of my job is service. So with this is basically giving back to multiple levels, either to the engineering department, the engineering school, to the university in general, to the profession, and then to the community. So I'm just highlighting some examples just to give you guys a flavor. I recently served on a search committee. So what is this? Basically, our department chair was retiring, so I got to be on the search committee where I reviewed applications and I helped to identify candidates that we then interviewed, and I got to talk with these people and help ultimately select our new chair, who just started the beginning of this month. Now, I also work on kind of a more university level type of committee, which we call FACS. As you can see here, it's the Females Advancing Clinical and Translational Science, another mouthful. But really what FACS is trying to do is we're trying to get women more involved in science and provide them with high quality professional development opportunities. So I was able to help plan these types of workshops, and one recent one that we did was leadership and survival skills in the time of COVID. And with this, I plan the workshops, I attend the workshops, and I help to facilitate discussions on these critical types of skills. Now, to give back to the profession, I will review other people's papers to help journals out. I will also do other things like review abstracts for conferences. So to basically, evaluate other people's work, should that be given a poster or should that be given an oral presentation? I can also help to facilitate talks on the days of the conferences as well. This is just an example here. I'm obviously not in this picture, but this is what grant reviews look like. So when people write documents to be able to get their research funded, somebody has to review those documents. So that's people like other faculty members and clinicians. They will go to these panels and discuss the strengths and weaknesses of these proposals. The last part, as I said, was, helping the community. So one of the things that I've had a really fun time with is being a poster judge. And I've done the poster judging several times at the Intel ICEP International Science Fair. And I just find it so amazing to talk to young people and find all the stuff that they've done at such a young age. They're so inspiring to me. I really have enjoyed it a lot when I've interfaced with them in the past. Now, just to give you some of my closing advice here, the main thing that I can say is don't ever lose your confidence and always remain optimistic. So this is not cliche. I really want you guys to reach for the stars. Literally aim as high as you can. In the end, what is somebody going to say? They're just going to tell you no, but hopefully they will tell you yes, and you will never know unless you try. So the other thing that I want to put out there is I know it's scary, but just try to interface with as many people as possible. Just start talking to people. This is what they call the networking. That's actually how I ended up getting my faculty position at WVU. I ended up, just contacting them and just sharing my CV. So you never know what is going to happen when you just interface with people and you talk with them. So to end on this kind of note, I just had my contact information again. Feel free to reach out to me, ask me any questions, and I wish you guys the best of luck in your future careers. Bye.